Hello, Melanie. My name's Irene. I'm a psychiatric nurse practitioner. Nice to meet you. I'd like to talk to you about two medications that's used for the treatment of insomnia. The first medication is called doxepine. Brand name is Silenor. The second medication is called sovorexant, better known by its brand name Belsomra. I'm going to go over each medication, okay? So we'll start off with doxepine or Silenor. Silenor belongs to a medication group called tricyclic antidepressants. Tricyclic antidepressants work by increasing these neurotransmitters in your brain called norepinephrines and serotonin. Silenor also blocks other receptors in the brain. It blocks histamines and then A1 adrenergic and muscarinic receptors in the brain. It is FDA approved for depression, anxiety, and insomnia. It is well tolerated and is very effective for patients with insomnia, especially primary insomnia. It can also help aid with smoking cessation as it decreases the nicotine cravings. So now let's talk about Belsomra. Belsomra is a dual orexin receptor antagonist, meaning it blocks these receptors in your brain called orexin. And these orexin receptors are responsible for wakefulness. Belsomra is well tolerated and is comparable to sedative hypnotics because it stays a long time in your system. Another benefit of Belsomra is it does not cause any rebound insomnia or withdrawal symptoms if you stop it abruptly. So now let's talk about some risks and side effects associated with each medication. First off, Silenor is contraindicated for patients with cardiovascular disorders as it can cause orthostatic hypotension, atricular heart block, and conduction abnormalities. The risk of abnormal thinking can also occur with Silenor, and behavior changes such as sleep driving and hallucinations. Worsening of depression and suicide ideation can also occur with Silenor. Some side effects of Silenor are sedation, somnolence, delirium, weight gain, decreased sex drive, and a metallic or bitter taste in the mouth. Some cholinergic side effects of Silenor include dry mouth, constipation, blurry vision, headaches, increased heart rate, and trouble urinating. Also, Silenor should not be taken with food. If taken with food, the therapeutic effect can be delayed, so the next day drowsiness can occur. It's recommended that it's recommended to not any food within 3 hours of taking doxepine, okay? So now let's talk about Belsomra. Belsomra is scheduled for controlled substance, meaning it has a high potential risk for dependency and abuse. The risk of decreased alertness and motor coordination can also occur with Belsomra. And also the risk of worsening depression or suicide is also possible with Belsomra. The most common side effects of Belsomra are decreased awareness, somnolence, headache, abnormal dreams, dry mouth, dizziness, diarrhea, coughing, upper respiratory infections, next day drowsiness. It can even cause sleep paralysis and hallucinations and temporary leg weakness both during the day and at night. The good thing about both medications is there's no real monitoring requirements for either one of them. Of the two medications, I would personally recommend Silenor. The main reason I would not recommend Belsomra is because it is a controlled medication, meaning it possesses a high risk of dependency as well as abuse. Silenor, on the other hand, is not a controlled substance, so there's no significant risk of developing dependency on it. I also know you're trying to quit smoking, and Silenor is a medication that can help with it because it decreases the nicotine cravings. However, you cannot take Silenor with bupropion. Bupropion is the medication you're currently on for the smoking cessation. If you take those two medications together, you increase the likelihood of a seizure. So if you do decide to take Silenor, we'll have to taper you off of bupropion first. What questions or concerns do you have about either one of these medications?